Hello and welcome to Cafdil Headline. Today we are discussing malaria. Malaria is so rampant, so common with us. And so when you are infected with malaria, what do? You just go to counter, buy some medicine, and you take it. And you think that is all? No. This and many more is what we're going to discuss today. Follow us on Facebook, Cafdil Cape Coast, on YouTube, Cafdil Edu, and share, and leave your comment. I certainly will read them for you. Today I have with me Salasi Agboga. She is a public health nurse at KEA Municipal Health Directorate. Salasi, you are welcome.
Thank you.
I also have a renowned public health officer in the person of Evans Agamlo. He is also at Cape Coast Teaching Hospital. Evans, you are welcome.
Thank you.
Yeah, like I said, today we are looking at malaria. Malaria is so rampant. We know when you mention malaria, everybody knows. But that is what we know. But we don't know the meaning. They only say malaria. But if we say malaria, how would you explain for us to really understand what the disease is? Let me start with you, Evans.
Okay, thank you very much, and my greetings to our cherished viewers and listeners. When we talk about malaria, malaria has been with us for ages now, and malaria is simply an infectious disease which is normally caused by parasites, and a specific parasite we call Plasmodium, and normally is transmitted through a bite from an infected female Anopheles mosquito. Malaria is curable as at this moment and is preventable as well. So when we are here today, we are here to remind ourselves for things that we knew of about malaria and some of the other things that we don't know of and some misconceptions about malaria. That's the main reason why we are here today, to help our listeners, the public, to understand malaria and how to be able to prevent it so that they will not go through the hardship that malaria infection brings to humanity. Thank you very much.
All right. I think it's good that you have given us the overview of malaria. Perhaps we all know what malaria really is. But let me come to you, Salasi. He mentioned mosquito. Is it the main cause, or we have other causes? Or what are the causes of this malaria that we're talking about?
Okay, so malaria is actually caused by the parasites, as he said, but it's the female Anopheles mosquito that transmits the malaria to the human body. So we have about 5 types of the Plasmodium parasites, but the one that is common in Ghana is the falciparum, Plasmodium falciparum, and that is accounts for about 98% of malaria cases worldwide. And we are in an endemic zone. Endemic means that it's common in Ghana. Like yati malaria, malaria. That is how endemic malaria is in Ghana. Then the other ones we have Malaria, Plasmodium malariae. Is that malaria? and no, it only accounts for about 1%. And then we have Ovale, then Vivax, but Ovale accounts for less than 1%, and Vivax is not even common. So it's the parasites that causes the disease. And whilst we are talking about the parasites, it's not all mosquito bites that will give you malaria. It's the female Anopheles mosquitoes that transmits the disease.
Yes. Females, you are dangerous. Females are very dangerous. I mean, being human or but do you have male mosquitoes? And what are they called?
Oh, I know they just said this control before
Oh, okay. They are not serious like that.
No, they also transmit. We have mosquitoes that transmit other types of diseases. For example, yellow fever is transmitted by a different type of mosquitoes, those that are found in the forest area. But the female Anopheles mosquitoes are special. They are ɛyɛ na efi sɛ ɛyɛ fi mosquitoes dey ɔmo pɛ baby a efi wɔ, but these ones they actually like clean water.
The female one.
Yes.
Clean water.
Clean water. It's ɔmo gata emu yɛ fi. Mosquito ɛbɛma wɔ malaria breed wɔ hɔ. Yes. Ɛyɛ nsuo a ɛyɛ korɔgye eti ɛyɛ a yɛka stagnant water. Eti nsuo a I'll gather in a can a ɛyɛ korɔgye Anopheles can breed there. Once you are we barrel one kataso, Anopheles will breed there. So it's not just any mosquito, but specifically this one.
Oh.
Yes.
This is the first time of we always think that those mosquitoes will breed there, that kind of things. And okay. So when you are infected with this malaria, what are some of the signs and symptoms that will let you know that indeed and yeah.
Okay, so when you talk about the signs and symptoms of malaria, it's not something that is cast in stone that once you've seen these things then automatically it's malaria. So we call something differential diagnosis. Differential diagnosis in nature say like we have like so many other conditions or diseases that present similar symptoms like malaria. So mostly we do not solely depend on symptoms to identify or like confirm that it is malaria. So normally we have like symptoms, common ones like headaches. We have like you see that your head is consistently aching you and all those kind of things. We have some vomiting out there. We have chills. You'll be shivering. You wake up and then you are shivering. Meanwhile, the sun is still up there, but you are shivering totally. We also have children complain of abdomen, not tummy. They would say tummy, but mostly the abdomen. Some of those symptoms are all attributable to malaria. But even if you are having or you are showing all these symptoms that we are mentioning, still you cannot say, oh, my child is suffering from all these symptoms that we are mentioning, so my child is suffering from malaria. You need to do a test to confirm. Yeah, you need to go to, let me say, the health sector to do a test to confirm. We have two main tests that you can do to confirm whether it is malaria. We have the RDT, that is a rapid diagnostic test. That one is common at the pharmacies, the over the counter drug store, and then the chips compound, the polyclinics, they are there. Then we have like another one which we call the BF, which is the microscopic one. That one is the golden generation one, because that one gives you, let me say, the various types of, let me say, the plasmodium, this thing type that she is mentioning, either whether it's the plasmodium falciparum or the malaria or the oval. So the BF gives you the extent of even the infection, so that they know what kind of treatment will be better for you at that particular moment. So for now, what we are preaching to the public is that the symptoms that we are mentioning here, that you will be having headache. When you are having malaria, you are infected with malaria, you show signs and symptoms of headache, you show signs and symptoms of vomiting or chills like feverish, those kind of things, or you feel signs and symptoms of you one way or the other having joint pains. So that like your joint are paining you, meanwhile you've not done any exercise, and as if say like you're having some rheumatism, those kind of things. You can still not just go in and say, I'm going to treat myself because I'm having malaria. No. Go and have the test. When it's confirmed positive, then the drugs are there that your pharmacist or your doctor or your health attendant to assist you to go on.
Okay, so the test is important. Is it because the symptoms is not solely related to malaria, the headache and stuff that
yes. As
there are other things that can also cause that.
Exactly, as I made mention, like we have other conditions that typhoid can present as if it's a malaria. Even if, let's say, a lady is pregnant, something we call like the first trimester, I mean the first 3 months of pregnancy, some of the symptoms that it presents, you will think it's malaria. You see that they will be vomiting, they will have like the fever and all those kind of things. So if, let's say, for instance, a woman or a lady presented with those symptoms, you cannot just go on malaria treatment without the testing. Okay, so there are so many other conditions that like present as if, even meningitis, sometimes present as if all those symptoms that we just made mention of. So the test gives you a surety that yes, it's malaria, so that you know what you are doing. Yes.
Selassie, at what point do those symptoms begin if we're infected with malaria?
Okay, so the incubation period for malaria can be between 6 to 30 days.
From 6 days.
6 days to 30 days from the bite of the infected mosquito. And like he's saying, the malaria actually comes in two forms, but the first one that you experience will be the uncomplicated malaria. So that one unique thing that you see is a cycle of hot and cold stages. So first you start feeling very hot, you're sweating and all of that, like when you're very cool and then the next stage you are feeling cold. I what do it's ube say saa nipa na nka onya baby cool and obekwa kwahye no afi ope ewiem na watena aha. So in children ube say na akwa no eti ewiem is because he's feeling cold and eti ewia ne ye ne de. And then the next stage is sweating, then you start feeling fine. Aha. And when it's a cycle. It's a first one ibeba na ejai. It's a bit of 2 to 3 days won't shave you. Then it comes again. Aha. That is one tricky thing about malaria. It's a cycle ne ebasanu. The next cycle la ebebanu. It will be severer than the previous one. Not just say plasmodium no multiply in the body. And see, America when they say sometimes always say how me I want to make a cry. And I'll show them me fine. Now we'll call baby. But that is uncomplicated malaria starting. It's one DH there. Obi said the next time a severe form will come, now you are getting into the complicated malaria, which is a severe form of the malaria. It is any organ. Sometimes you feel like, oh, malaria there, we know me all know. Me award me. Any malaria until we can malaria do. But the disease is not going. Meanwhile, it could be something else in the body which can get worse because you didn't treat it early. Did that answer your question?
Yes, you did. You did. You really did. But one thing that I'm sending you back because you made mention of that mosquito. They don't stay at those filthy areas and stuff. So it means it does not matter your environment.
Oh, it matters. The environment matters. Nyana make can say. Also, and I said earlier, say mosquitoes no. There were more ahudo bebree. And the ones that cause malaria, strong. Even their biting time is not early evenings. Mostly they bite when it's very dark. And at sapa na omoka. Their breeding ground omo here clean water. But the other types of malaria, the other types of mosquitoes transmit other diseases. That's why we clear all the stagnant waters, we clear the gutters so that the other mosquitoes will also not get a breeding ground. Okay, but these ones, if you get malaria, then it has to be the Anopheles mosquito. But Anopheles, no, they are very common. In Ghana, top 10 disease, malaria is always among the first 3. They are very common. It's not just a area, no, a bomb. Yeah.
I think I want to add a little bit to what my fellow colleague said. You see, I think we didn't wanted to, let me say, like go into the types of mosquitoes. But I say, even when you look at the female Anopheles mosquitoes, we have different types. We have like the one we call like is it the Gambian species, by the Anopheles Gambian species, which is common with us and in Ghana here. I think the recent one that they've discovered is, I think, is it the Sapiensis or something of that nature. This 2023 that they discovered that one. So as she's saying, you see all the other species, about 3 of them, all of them they breed in the, let me say, clean stagnant water. If the water is flowing, they don't You don't find them. You find different species of mosquito, as she is saying. But this particular new one that they found out, this is like a I'll check the name and get back to you. But that very one, you will see that they said it breathes even in stagnant areas. This dirty place. And they found it, the first species that they discovered is at Dansoman. We could imagine how clouded Dansoman area was. The first year they found it, I think 2011, from Asia, before they trickled down to Djibouti to, I think, Mali recently, and then 2023 they found it in Ghana as well. That very species council transmits malaria. So what we are saying, as she said, is it doesn't matter whether it's clean water or dirty water, stagnant water. When it's in your area, try to drain it. Okay, try to drain it, because mosquito takes almost, let me say, 2 to 3 weeks for them to develop. So every stage, if let's say like the water has been there for 2 weeks and then you've seen it, come on, drain it away. If it's 1, 2, 3 days, drain it away, then you save yourself from all these species that we are talking about. But the most common species in Ghana is the Anopheles gambiae.
Okay. But I wanted you to, even though you may have mentioned the causative agent and different types of it, if you can help us so we can explore more about the causative agent, different types of those causative agents.
That's what we said. So the parasite is the Plasmodium parasite. It says that it has different types. It's a falciparum. It's the highest causative agent, and known in about 98% of malaria cases. We don't say that is the cause of the disease. Yes.
All right. But I want to know whether there are any group of people that are particularly at risk of this malaria.
Yes, there are a group of people. Normally, everybody is at risk, but we have like a certain group of people that they are at more risk. And these people are normally children under 5 because of their immunity. We say that they have low immunity. So children under 5 are very susceptible to malaria. Then we have women that are pregnant women. They are also they have high risk to malaria infection. Then we have people who we call like immunosuppressed. Immunosuppressed, let's say, like people that they have other conditions that have already suppressed their immunity, like people who are suffering from HIV, people who, let me say, are malnourished. Those kind of people, their immune system are perceived already to be suppressed. They have low immunity. So the possibility that malaria, when it attacks them or it affects them, will go to complicated stage is very, very high. And we have people also who we say that like they are non-immunized, as in like they are not immunized against the condition. And when you say immunized, it's so a little bit tricky when it comes to malaria. We say people who are stayed in the endemic region of malaria are automatically immunized. So if, let's say, for example, I've been in Ghana, because malaria has been common in Ghana, automatically they perceive me to be immunized against malaria. But we have people who come from maybe the Europe countries, the American countries, those sub-regions, that malaria is not common. Because you see, when you can talk about the Anopheles mosquito, it has a temperature range that it can survive. It cannot survive, let me say, below temperature of 19 degrees. So because it cannot survive below temperature of 19 degrees, our neighboring Europe countries and those kind of things, they are temperature negatives. So as for them, malaria is alien to them. So even if you look at, let me say, as she was saying, the prevalence of malaria, Africa alone has taken about 97-95%. So malaria, all the worldwide, that's a worldwide, when you take 100 people, about 97 people are coming from Africa. So meaning they is the things of pass to them.
97?
Yes.
3% are coming from where?
Europe, and then those kind of things. So even that one, we perceive that our people, they have the condition within them before they go there, and they go and manifest it there. So if, for instance, I've traveled to go and stay in America for more than 6 months, they consider me that I'm no more immunized because my system has adjusted to their side. So if I come back to Ghana, the probability that I'll be at high risk to malaria is very high. So that is so far so good. The kind of category of people that are very, very susceptible or high risk to malaria.
And I want to add to the fact when he says immunity, and which I say, oh, the tutum kawa unya malaria. No, we as a akaya yenya malaria yenya so we have developed some resistance to the malaria. It's obia and tutum Canada or no bar. The severity of the disease now mean yenri no benyano or no in a severer form than us because yeah as a debia your mouth just back
And that's on crabbing in them.
no private that it in
Sentence, yeah,
that is the immunity he's talking about. But whether you are endemic or a traveler, you are all prone to getting malaria.
All right. You're still watching Cafdil Healthline. We discussing malaria, and we know how malaria is very common, and we've heard lots from our practitioners. But you know, in Central Region, we've been classified as one of the poorer or poor regions in Ghana. I want to know how that contribute to the persistence of malaria in Central Region alone.
Okay. Yeah. Also, money does a lot for us, and from the home, if you senior yeda, sometimes a lot of people in the room, it's a demo shape. People don't necessarily have cabinets and wardrobes to keep their things in it. Or one hanging, career wall, a dining room, and the mosquitoes, they like those places. And we've already established, say, heat is a good environment for mosquitoes. So we will say obvious in it now the window, small square and there too. So if a man so mosquitoes are comfortable in that room. And we are one factor. Then sikasem so be area. Oh, to say senior I talked about the cycle of malaria. It's the first bout of symptoms, your cold, hot, and cool face. No, obviously when you want on it's you. So normally by the time the panic hospital, no, he or she is almost in the complicated stage. Which treatment is higher and the cost of treatment is higher if that person had gone to the hospital earlier at the first symptom and avia treating but on costica 70 and then the next time is worse or you meeting a time then because most times it comes with loss of appetite, comes with vomiting. We will start treating the symptoms instead of the disease itself. And by the time you realize it gets to the complicated side. Malaria, Ghana, I checked. We've been treating malaria for a long time. So it's surprising that we are still dying, our children are still dying of malaria, and it's because of poverty. But everyone's
I think she has said almost all of it. You see, when it comes to poverty play a strong role in the health sector. You see, even if you see malaria alone for Ghana, they say it's one of the major causes as they cause burden to the National Health Insurance Authority. Because for now, most of the testing and then the drugs are on NHIs. But because of poverty, people cannot even subscribe to the health insurance. So when they are sick and then they come to the hospital, you cannot perform miracle because you need to account for every service that you render to your patients or your clients. So you realize that this person is suffering from malaria, but the person doesn't have money to purchase to purchase the drug. He's not having health insurance too. So nothing you can do. Such a person is going to suffer. go back home to go and suffer, which like it can even help the transmission of the condition to other people, because another mosquito come and invite such a person, take the parasites, like grow it within the mosquito and going transmit it to another healthy person. So poverty play a strong role. Even our housing aspect. Most of, as she say, most of people who doesn't have the financial capacity, the places that they live is not a good condition for you to have. So poverty is number one is a factor when it comes to malaria incidence rate in the central region.
Then we will continue to die. Because if you look at the situation, like what you just saying, where are we going to get money?
That is the reason why. That's the reason why we keep asking, like we keep appealing to the public that even if you don't have money, the NHIS government has done its part. Try and then like keep it active no matter what. Some people will be like, oh, for the past 5 years I've not been sick, so why should I go and then give government 20 cedis or 12 cedis to keep my NHIS card active? But it will surprise you to know that if you come to the hospital without NHIS card, the hospital card to get, the amount you pay is not something small. Right now, we all hear that government said that all the health sector, all the hospitals should start paying their own water bill, should start paying all their own light bill. They transfer all that back to we the public. So if let's say for example your NHI is effective, when you come with some of these minor conditions, the malaria for instance, come on, you'll be treated freely and then you go home freely without you spending a penny. So let's all help ourselves so that like we won't be like, oh, we are poor, so the economy is very hard, but I think let's help ourselves for us to also help.
So from what you are saying, you don't see when malaria in central region is going to reduce?
Well, the statistics is fluctuating. It's reduced and come back, reduce and come back. But we for now in Ghana we have malaria control agency from the national that they implement so many measures down to, I'm sure we'll be talking about it as we go on. So they are trying their best that by 2025 they will reduce it to the barest minimum. And for so far, some of the data that they are churning out, they are doing their best and the numbers are coming down. So we also hope that we will help them to make sure that like their work will be achieved. And if their work is achieved, we will benefit, because malaria will be a thing of the past. But for now, they are suffering from malaria.
We hope so, because some years back they said by 2020 it will be reduced, just as what you just said.
Yes.
And we are in 2024. You are saying by 2025.
Now can we even move from the control to elimination stage? Yeah. So they are also doing their best. Yeah.
You made Selassie, you made mention of mosquito. We talk about malaria, the two things. So I want you to tell us what is the relationship between the mosquitoes and malaria transmission?
So the mosquitoes are the vectors that transmit the malaria. So without the mosquitoes, we wouldn't have malaria. Yes.
Oh, okay.
So that is why mostly the prevention measures are always targeted towards getting rid of the mosquitoes. Because even though malaria is communicable, it's not contagious. I mean, malaria, I can't transmit it to you by touching or any other means, except a mosquito bites me and comes to bite you. So that is why we are always targeting the small abuana mosquito. So that only more malaria is gone. Yes.
Oh, all right. That's good. Once it is not contagious, but so when the disease is contagious, that is also very dangerous.
Yes.
So malaria, those of us who think if someone is suffering from malaria and the person touches you, you have to debunk that one.
I think research is coming up to say that sometimes through accidental transfusion, they may. If let's say for instance I have the parasite within my blood, and then through accidental transfusion, my blood has not screened well, and they transfuse it to you. Meaning it has not been fully
accidental what? Transfusion.
Yeah.
And you have that. That the blood is not screened well.
Most of the time it happens. There's like you see, for transfusion to happen, let's say the blood goes through a lot of process. Sometimes you go to the blood bank, they tell you that this blood will take maybe 4 hours for us to work on it. That 4 hours meaning they have to screen to make sure that it's safe. So if let's say for example somebody need blood within, let me say like within 2 hours, and then if the person didn't get blood within 2 hours, the person is going to die. They also have to one where they take some risk. So those are the title accidental transfusion. Or some accidental needle break, and if the parasite load is also and so you can. But that's made. It has not been approved.
It is rare.
Yeah.
Okay. Because this is the first time of hearing it.
Yeah,
It is the first time.
So there is the rate at which that will happen is very, very low. Very, 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 very.
All right. Sometimes we get climate change. So I want to know the impact of this climate change on the spread and prevalence of malaria.
Yeah.
From November.
Yes.
Look at how
hot. Yes.
the weather has been.
Yes. And this season too, we are very we like opening our windows for fresh air to come in, and if you don't have nets and co, because the hot weather causes the malaria in the mosquito to mature fast. It's occur in within the next few days it can transmit to the next person. That is why pregnant women are also very vulnerable to mosquito, because pregnant women is even they have very high temperatures. So that is why they are prone to malaria. So the climate change, when the climate changes to a hotter season, then mosquitoes can multiply the malaria parasite fast and transmit. So the rate becomes higher. But in the cooler climates, then it goes down, because obecha and sana parasite ne owo mosquito ne mu obenyin na wetuma ama malaria.
All right. Let's come. Okay.
Let me add a little bit to what she said. You see, in Ghana, because malaria is something that's like they've been monitoring, and then like they want to eliminate it, they want to eradicate it. So they've been monitoring, and then they have, let me say, the seasons at which you know that okay, when it comes to central region, these are the seasons that we have the peak of malaria. So I think they divided the whole Ghana into about 3 or so. The northern sector normally experience one rainy season, so they know that okay, in the period from let me say June to let me say September, that is when they have their rainy season. So that is when they expect the incidence rate to let me say like or the prevalence to come up high. Then we have when it comes to the coastal, and then like the other forestry areas that we have to rainy season. We have from sometimes like from May to June, and then from August to September, November that side. But you see climate change. You look at even last year, what happened? The rain season pattern has changed all of a sudden.
Totally.
You understand? So it affects even the planners, and then those who bring the resources and how they plan to attack the condition nationwide. So they are still doing the studies, but these are some of the what climate change can do to the condition. So sometimes if we ourselves we know that okay, let me prepare myself and buy some of the things I'll use to prevent malaria, the insecticide, and then the mosquito nets and all those kind of, let me get them ready, because rainy season is coming. All of a sudden the pattern has changed. The rain started coming when you've not prepare yourself. Of course, you are going to be exposed to the mosquitoes and then get infected with malaria. So the climate change here has affected all of us, and then the malaria greatly.
All right, you made mention of mosquito net. Let me come to the prevention.
Okay.
So I want to know how effective mosquito net in preventing malaria transmission. How effective it, because nowadays when you go to backyard gardens, you see a lot of people using mosquito, fencing their backyard gardens. Does that mean it's not effective or what? So how is it effective? How effective that mosquito net is?
Okay, so mosquito nets, or we call them LIN, and the long lasting. insecticide net. They are very effective, okay, but it's our attitude towards the usage, okay, that is, let me say, like hindering us. But so far so good. As at 2021, the Malaria Control Agency are saying that they've had about 49%, let me say, usage, about 49% usage. Unlike 2011, that we were having about 19%. So many people have started using it, but they are having issue with people who live in the cities. Like we living in Cape Coast right now. Cape Coast is considered an urban center. You see, the mosquito insecticide net, normally every 3 years they do mass campaign which they share to everybody. You see that when you go to the villages or the rural areas, people come out in their numbers to register for it, and then they come and take it up. But when you come to the urban center, we think, oh, we are in the aircon and all those kind of things, so we don't even go for the registration. If they even register, they don't come for it. So at the end of the day, it's like it's very effective, but our attitude towards using it is a problem. Like you are saying, it will shock you that people will even come for it, and then they will go and use it to do backyard to prevent goats, sheep, and pigs from destroying their plantation. People will even go and use it to go and do fishing. But we've been trying our best to educate them that this is not the purpose of it. The purpose is to save your life. Look at your life as a human being and the life of your tomato. Which one is more important? You will come for it and go and use it to save the life of your tomato. Then leave you, the human being, dead, which is not, it's not the best. Because like as we said earlier on, the Anopheles mosquito have species. That the Anopheles gambian that we are talking about, research has shown that like normally they live indoors and they bite indoors, and they are the most common in Ghana. So meaning their habitation or is your room. So if you should have the net to protect yourself within your room, come on, it's like you are 60 to 70% saved. Because how many minutes we spend outside during the night? We spend almost all our time indoor. So why can't we, one way or the other, like stick to this mosquito net, eradicate or like eliminate this kind of malaria infection from our midst, like the outside world have done? They will all live peacefully.
So it may, but I want to know whether you've implemented some effective malaria control, its prevention. And from what you are saying, it means there are so many challenges. Apart from this, Salasi, can you give us what are some of the challenges in implementing this kind of control?
So the challenges, the major challenge with malaria control is our attitude, is the people's attitude towards the malaria control program. Number one is with the ITN use. The nets are insecticide, so you can mosquito can say, but even if the drugs in the mosquito net is gone, you can still get the mechanical protection. But by sleeping in the net, it's into 2 minutes. The holes are too small for the mosquito to enter, so you are still protected. But Obeka said, "Udemwa eshu it's under." But when we pass udem for mosquitoes will while the cow. So number one is our attitude. It's our attitude when it comes to keeping the environment clean, getting rid of stagnant waters, covering our waters. Also, will be a water crisis in it. Barrel, nibbles, but they are uncovered. Mosquito in ya baby or bear and they are living in the room with you. It's a if you are the cow. So majority is our attitude. Over virgin nets, no, they acquire or the coachy fish. Ube home mosquito net na obia top ediaba abecho free na ajigadi.
For registers only will be the first person who had to register. What kind of household, right?
Yes.
Yeah, not the basics.
Or I can't say one man I'm announced. But
basics. They say 1:1.
Yeah.
But over you 1:2. We are the one farming. Anyway. Well, let's see the vaccine. It has vaccine, right? Malaria.
Yes.
So what is the latest development of it? those
Okay.
vaccines?
So I think 2019 they started with the malaria vaccine. I think they started with the implementation for Ghana, Malawi, and then Kenya. So they selected some districts or some regions, about 6 regions, of which Central region was part, as a piloting something, of which I think Cape Coast CCTH were also part. So we're giving it to the young children, babies from this month 6. So they've done it to almost, I think, 2019, when like now the country has adopted 2020, when the country has adopted it, that is good. So let's enroll it for everybody. So as at now, malaria vaccine is added to the routine vaccination. So if you've given birth, by 6 months, they'll start giving it to your child. And they realize that those children that they've received the malaria vaccine, the rate at which they get infected with malaria has reduced drastically. So we are encouraging everybody that when you come to weigh, or you've given birth, you come to weigh, they say, oh, month 6, your baby have to take malaria this, then please and make your child available. Month 7, you take the second shot. Then at month 9, you take the third shot. And I think month 18, you take the final one. Then you are mostly, because you see the children are those that's like, as we made mention, that some of those at high risk, the children under 5 are number 1, and then the pregnant women too. So with the pregnant women too, there is a preventive mechanism method for them that they use to protect them too as well. But the vaccination there, so far so good. Ghana has done very well. And they've added it to the routine vaccination. It's free.
That one, nobody has any myth surrounding it.
Oh, vaccines, yeah.
Because when vaccines are introduced, there are a lot of myths.
Yeah, so
So I want to know whether, since you are doing well, or Ghana is doing well in terms of vaccine, it means that you have to for malaria vaccine.
okay, so vaccines, the myths are normally created by we the public, spreading lies and propaganda. Okay, but when it comes to vaccines, normally every baby that is being vaccinated is being monitored because something like adverse effects reaction. So we monitor everybody's system react differently to things. So if, let's say for instance, a baby A has a minor reaction to a vaccine, that doesn't mean say vaccine is not good. But so far so good, this malaria vaccine, there hasn't been any serious adverse effects reaction out there that like people can feed on, and then like they'll be spreading that is not good to so and so. But the traditional myths are there. Yeah, the traditional myths and lies are there.
All right, our time is up, and so let me give you a minute. What's your advice to our viewers and the general public as well?
My advice would be to the pregnant women. Malaria in pregnancy is a very serious thing that we have to take seriously. So when you get pregnant, also when you pet for ANC, by 16 weeks, you have your first dose of SP. Then ubefa at least so to minimum 3 mpoa you be done yamia say even if you get malaria enko how make aquano. So for pregnant women, malaria in pregnancy, prevention of malaria in pregnancy is very, very key. So if you are pregnant, go for your antenatal clinic, take your SP, and then pray that you don't get any severe case of malaria, and protect yourself. We have other ways of preventing malaria: indoor residual spraying. Every now and then you spray your room. So one person of better mosquito net would get to spray your baby. And once while if you are in an endemic zone, mosquitoes does one. If you are when you are going out to work, you spray, you close all the windows. By the time you come back, they are all dead. Then you can live in the room, so that we can leave malaria.
All right, Evans.
Yeah, thank you. My short message is that malaria is with us. So I'm appealing to the public, each and everybody, that we have something we call T3, test, treat, and then we track. So when you start experiencing the symptoms that we made mention of here, don't just go and self-medicate. you can go to the drugstore and they get you tested. All of them are having the test kit now. Then if it's malaria, they give you the medication and they treat you. If you have any side or any reaction or anything at all, report back. Do not sit at home and then keep it to yourself. And to our cherished ones who like we know that our financial status is not that good. I'm begging all of us, try and then let's subscribe to the health insurance so that should in case we get infected, we'll be able to get good treatment. Thank you very much.
All right. It's very serious illness, just as what we've heard, but we can take it. And if you are pregnant and traveling to where malaria is common, make sure you talk to your provider before you leave. Thanks so much for listening. This is where time will allow us to be with you. Thank you so much to my producers, to my cameraman, to Salasi Agbaga. She is a public health nurse at KE Municipal Health Directorate. Salasi, thank you very much. Evans Agamlo from CCTH. Thank you so much, Akwe. Same time next week. Follow us on Facebook, Cafdil Cape Coast, on YouTube, Cafdil Edu. Same time next week. Shalom.